Okay, ladies and gentlemen, welcome to the European Parliament. Firstly, I'd just like to welcome everybody and just say at the outset, always be conscious of the fact that this is a Parliament that represents the citizens of Europe, so it's primarily your Parliament, and we're your representatives here, and we're delighted to facilitate any debates, discussions, development of policy, engagement with stakeholders, so we very much look forward to this discussion today. Firstly, I'd like to thank the European Institute on Women's Health and their proposals towards an EU strategy for women's health and the recommendations from over 50 expert organisations to formulate this manifesto. And while the European Union doesn't have competency in the area of health, it's still a member state competency. I think there is an understanding and probably a need to move towards some form of health union that pools resources, that identifies issues that are a significant challenge to population bases across the European Union, areas of procurement, research, making sure that we have benchmarks and standardized diagnostics, access to treatments. And they are key issues, I believe, that we need to address. My name is Billy Kelleher, and I'm a Renew MEP from the constituency of Ireland South. I'm from Cork, so if you can't understand my accent, please tell me and I will speak in a neutral European English-speaking accent. Just to say at the outset, I'm involved in drafting a paper, an own initiative report on the issue of gender equality in healthcare. And in doing that, it is quite evident that we have a significant journey to travel to ensure that women and girls have access to timely diagnostics, treatment, that we invest more in the areas of research and innovation, that there's more academic studies done in the whole area of healthcare for women, ensuring that at some stage into the future, we will have true equality. We have a long way to go. Our health services are male-centric in terms of, over many, many centuries, they've been male-centric. And very often the research in areas of clinical trials is very much male-centric. We have that quite empirical evidence now that we really have to address that particular issue. And of course, that has its own challenges in the downstream in the areas of diagnosis and treatments and therapies being made available that may not be fully in line with a woman's autonomy or biology. So we really have a long way to go. So I'm in the process of drafting that. Amendments are being tabled by the various political groupings, and hopefully over the next number of weeks we will be publishing the final draft report, and that will feed into the discussions and the broader discussions in terms of the European Union strategy around gender equality. But I do hope that today will highlight and move that momentum that is beginning to gather in certain areas. There's a lot of campaigning being done in Ireland, for example, around the whole issue of endometriosis, menopause, some of those significant challenges that every girl and woman can and will face. We also have real inequalities in the area of diagnosis, for example, in heart disease, in cardiovascular disease, really delayed diagnosis in those key areas. So we have a lot of work to do. So I'm delighted to be here and just to give support to this. And I do that for many, many reasons. Previously in Ireland, in my own national parliament, I was a spokesperson for my party for health for 7 years. But in that time, I saw firsthand some of the real challenges and barriers to women's access to equality in general, but obviously underscoring the whole issue of access to healthcare as well, childcare and many other areas that really significantly disadvantage women. We were also very much involved in the campaign of what was called Repeal the 8, which was a constitutional barrier to access to free legal abortion services. And that was ultimately overturned in 2018 after many, many years, which now facilitates access to abortion services and health and sexual reproductive rights services in Ireland at this stage. So we're very much in line. We also have to be conscious that while we live in democracies across the European Union, there's still about 20% of the women who reside in the European Union who do not have free legal access to termination of pregnancy, and we just have to be conscious of that as well. So Without any further ado, and just again welcoming you all, I know we started a little bit late, so I will keep my introduction short. And as we say in Ireland now, enough about me. We'll get somebody else to talk about me. So, but on this occasion, I'm delighted to introduce Professor Miriam Schulke-Ochak, co-chair of the board of the European Institute of Women's Health. So I hand it over to you, Miriam.
Thank you very much. Thank you very much. Thank you very much. It's great to be here, and it's a pleasure and honor for us to be here. And thank you so much opening the doors for us. Good morning, everyone. It's a real pleasure to be here today to launch towards an EU strategy for women's health. I would like to begin by sincerely thanking Billy Kelleher, MEP, for his leadership, commitment, continued support for advancing women's health at European level. As rapporteur of the FEM Committee report on gender inequalities in health, his work is instrumental in placing women's health firmly on the EU policy agenda. His engagement sends a strong and timely signal that women's health is not a niche concern, but a core European priority. I would also like to acknowledge all our partners, stakeholders, and colleagues who have contributed to this work and who are with us today. Why an EU strategy for women's health? You have mentioned some points. The rationale for launching an EU strategy for women's health is clear and compelling. Across Europe, women experience persistent and systematic health inequalities in access to care, in research, in diagnosis, and in outcomes. Women live longer than men, yet spend more of their lives in poor health. Conditions that disproportionately affect women remain under-researched, underdiagnosed, and underfunded. These realities are now clearly documented at EU level. The FEM Committee report on gender inequalities in health, led by Billy Kelleher, will provide robust evidence of structural and systemic gaps in how women's health is across the Union. At the same time, women's health is too often addressed in silos. Reproductive health in one space, mental health in another space, aging somewhere else, without a coherent life course and gender-sensitive approach. An EU strategy would address these gaps by recognizing women's health as a cross-cutting social, economic, and equity issue, ensuring policy coherence across health, employment, social protection, and research, supporting member states through shared goals, data, and best practice, and crucially, making women's health visible, measurable, and accountable at EU level. Alignment with EU gender equality frameworks. What does it mean? Importantly, this initiative does not exist in isolation. It directly supports and complements key EU policy frameworks, including the roadmap for women's rights and gender equality strategy. Both frameworks recognize that gender equality cannot be achieved without addressing the structural determinants of women's health, including access to healthcare, working conditions, unpaid care responsibilities, and lifelong health needs. A dedicated EU strategy for women's health would provide the necessary health pillar to underpin these broader equality ambitions, ensuring coherence between gender equality objectives and health policy delivery. EIWH's track record and stakeholder support. The European Institute of Women's Health has a long and credible track record in this area. In 2024, the EIWH published its manifesto on women's health, developed through extensive engagement with policymakers, clinicians, researchers, civil society organizations, and women across Europe. That process demonstrated strong stakeholder consensus on the need for EU-level action, clear evidence-based policy priorities, and growing political appetite to move from fragmented initiatives towards a strategic framework. This report builds directly on that work. It reflects not only EIWH expertise, but also the momentum generated by the European Parliament, particularly from the FEM committee's work, and the collective voice of a wide and committed network. Why now? The policy moment. As board co-chair of EIWH, I see strong commitment to women's health across Europe, but too often without the policy framework needed to translate that commitment into consistent delivery and outcomes. That is why the timing of this initiative is so important. We are at a critical juncture. New EU health and social initiatives are taking shape. Gender equality and social resilience are increasingly recognized as drivers of competitiveness and sustainability, and preparations are beginning for the next multi-annual financial framework. Decisions made in the coming months will shape priorities and investments for the next decade. If women's health is not embedded now alongside the roadmap for women's rights and the gender equality strategy, it risks remaining peripheral once again. This is the moment to ensure that women's health is reflected in EU funding priorities, integrated into health, research and social policy, and recognized as essential to Europe's demographic, economic, and social future. Closing. Towards an EU strategy for women's health is not an endpoint. It is a call to action. It invites policymakers, institutions, and stakeholders to work together to ensure that women's health is finally given the strategic attention it deserves, fully aligned with Europe's commitments to gender equity, social justice, and sustainable development. Thank you very much.
Thank you very much. Thank you very much, Miriam. Now, we're going to have a discussion at the end, so obviously we'll go through all the speakers first in the presentations, and then we'll have an open dialogue at the end of that. So the next speaker, the European Commission perspective, Ms. Ana Carla Pereira, Director of Equality and Non-Discrimination within DG Just. Reflections on the relevance of this initiative. So over to you, Anna.
Good morning, everyone, and thank you very much to MEP Keller for bringing us here together. It's a very well-attended event, which just shows the importance and the timely character of this conversation. I would also say it's primarily a conversation among women because there are so many women in this room. So we should also, I think, congratulate the men who think this is an important topic, not just for women, but for them, I think. And in that respect, MEP Kelleher is a good role model, if you allow me. You have already said many things, and I would like, first of all, to congratulate the Institute for bringing together the voice of many different experts and putting it in a coherent manner to us. You have mentioned the roadmap for women's rights, and this is where I would start with the Commission comments for this conversation, because as you are aware, last year the Commission presented the roadmap for women's rights, and this roadmap has, thanks to the support of the Polish presidency in the Council at the time, and the support of the Parliament, especially the FEM committee, we were able to galvanize support across all the EU member states, across all the EU institutions, across civil society, social partners, on the principles that this roadmap brings, with an affirmation that gender equality is not something to be questioned, but on the contrary, something that is worth fighting every day. And we do know that there are many anti-gender narratives going around, and that it is really important politically to reaffirm our collective commitment to gender equality. Now, the roadmap has one principle specifically dedicated to health. It's principle 2 that says every woman has the right to the highest attainable standards of physical and mental health. And I think we all agree to this objective. Under this broad affirmation, of course, there are issues related to gender sensitive research, medical research, clinical trials, diagnostics and treatments, as you have said. There is also the issue of access to quality healthcare, whether it's obstetric, prenatal, postnatal, childbirth. There is, of course, the issue of mental health, and importantly also women's access to sexual and reproductive health and rights, which is such a contentious topic even in the political spectrum. And this is one of the points that is worth mentioning every time there are anti-democratic narratives emerging. Then the first thing that is attacked are sexual and reproductive rights of women. And so it is really important that this is one of the building blocks of whatever we are doing related to women's health. Of course, the menu is long and important. And we do know that there are many obstacles for the concretizations of these principles. As you have said, there is a long tradition of non-research, non-diagnosis, non-training on women's anthropomorphic features, on women's specific health conditions. And this has led today to clear cases of where diagnoses are missed, treatments are wrong, with an effect to women's, to the individuals, the women themselves, but collectively to all of us. It is only now that we start to talk about menopause, for example, and what does it mean for all of us, for the companies, for example, where women work. What is the impact of what is the economic impact of some women's conditions? And it is really important that then we use this momentum to go further in the conversation. We also know that there are financial barriers. We know you've mentioned social inequalities. We do know that some groups of society are more affected than others. When we talk about, for example, access to contraception, menstrual poverty, we do know that, for example, homeless women or LGBTIQ+ women in all their diversity are very much affected by these circumstances more than, let's say, the average white, if you allow me, white woman. We also know, I think, that the backlash on gender equality does have also an immediate effect on the political attention that we give to healthcare, and particularly healthcare to women. Because as we start to speak more loudly about women's access to health, there is a sort of a narrative now saying, oh, but we need to take care of the cardiovascular diseases for men because they are also very much affected. And this is true, and we should not deny this. Obviously, heart diseases and heart attacks are also prevalent in men. The question is, all the research has been done around their bodies. So there is not lack of medicine, there is not lack of diagnosis for men to be treated. Conversely, when it comes to women, if you have a heart attack and you don't know what are the symptoms, because it's not your left arm that is in pain, is maybe a burn in your stomach, then you probably are more at risk that this heart attack has severe effects on your body. So I think we should make sure that the conversation is properly framed, that we do not miss the focus of that is just being galvanized with conversations of this kind. And therefore, I would say that, of course, this house has a very important role in this conversation, because the FEM committee is traditionally a committee supporting gender equality, but we also see how it has been evolving in the conversation due to its larger political spectrum. There is also the Santa Committee that I believe is worth bringing to the conversation, because this is not just a gender equality conversation, this is also about health policies. And more broadly, I would say it's about economics. We should, in a world where we need to focus on competitiveness, where we need really to bring Europe to a new level of innovation and bring our companies, our economy to the forefront, it is really important that these issues are also discussed from an economic perspective. How much does a company miss if we don't understand what are, for example, what are the issues around menopause or endometriosis? What is the economic benefit of actually addressing these issues for the woman in question, for the societal system, but also for the company that is, for example, recruiting that person? So I think this is an angle that is always worth underlining, to be able to be meaningful in the mainstream conversation on the political priorities. On our side, we have two important points or moments that allow us to reflect on this issue. You have mentioned the future gender equality strategy that we are currently preparing. The new gender equality strategy will be adopted on the 4th of March, ahead of the International Women's Day, and intends to look at what we can do for gender equality from 2026 to 2030. And it's totally inspired by our roadmap for women's rights, and thus, obviously, the issues of access to health will be a very important component of this gender equality strategy. Where do we focus on? On partnerships with organizations that are specialists on health, like the World Health Organization. We focus on funding and supporting access to contraception. We will focus on studying what are the economic effects of certain women's conditions. I would wish that we also discuss training of health professionals. Maybe this is a bit more difficult, because between health, which is, as you rightly said, a national competence, and education, which is also a national competence, it's very difficult for the Commission to come into this sphere, but I think it's worth bringing to this conversation as also an important topic. And the second moment or rendezvous is really around the MFF, as you rightly said, because policy can be done through laws. We don't really have the competence to legislate in this area at European level, but policy can also be done through money. And the MFF is really the right framework for that. The Commission, in its proposal, presents the idea of having a gender equality horizontal principle across the entire MFF. That means that gender equality needs to be embedded in the different programs, the Competitiveness Fund program, Global Europe, the NRPPs, etc., etc. And I think this gives us a good opportunity to deepen the discussion of how money can actually help solving some of these problems. Thank you very much.
Thank you, Anna Carla Pereira. Firstly, my apologies, but I'd like to acknowledge Joanna Shearing-Villius, S&D member of the European Parliament and an exceptional advocate as well for the advancement of women's rights. So my apologies and welcome and thank you. Now we'll just go to the next speaker, EU Commission perspective. It's Ms. Henrietta van Eel. Am I Eel? All right, my deepest apologies.
So thank you very much. My name is Henriette van Eyl, like a Nile without the N. So you'll never forget this. So many thanks for inviting me. Many thanks for inviting my director, Pilar Aguilar. She could not be here today, but you have me. And you have me because I'm quite a practical person. So I'm going to pick up where my colleague Anna Carla Pereira has left. And I'm going to discuss with you a little bit what we are doing on the health research and the social sciences research part, because Peggy asked me a number of questions about this, and I'm very duty bound to answer these. So again, many thanks to you, MEP, Mr. Gallagher, many thanks to you for organizing this. I would like to discuss with you three things. One is the state of play. Secondly, what are we doing in 26, 27? And thirdly, what is maybe some hints around the future programs. And when I was preparing for today, I was struck by something that happened in the last negotiations of Horizon Europe. And the last negotiations of Horizon Europe, MEPs submitted approximately 5,000 amendments to the Horizon Europe proposal 21-27. And I would like to start with this because I think there's a lot of opportunities, as you said, to come in and to bring your policy perspectives, your policy needs in these proposals. And especially because the proposals are quite succinct. Yeah, they're quite succinct. So up till now, the European Union has already invested around 2 billion euros in more than 1,000 research projects that are focusing on women's health, from anything from cardiovascular disease to cancer to gender-sensitive healthcare research. We really look at all the different parts of healthcare, from prevention to screening to clinical studies. Now, in the way we're doing this, we also very much look at the opportunities for women researchers, and we track this very well via the gender equality plans. Now, we just published the final work programs for 26 and 27. And in the health cluster, I see that we have dedicated 220 million euros specifically for women's health research projects. The total budget of cluster 1 for these two, this is about 1/3 of the total budget of cluster 1. So 220 million euros are dedicated to women's health research, and this ranges from cardiovascular diseases, as you just mentioned, cardiovascular diseases. We're looking at post-infection long-term conditions, the long COVID type of activities where, again, women are diagnosed and treated and present different clinical symptoms than men. We're looking at what does it mean to have chronic non-communicable diseases in international environments. So for us, the international cooperation in women's health is very important. We have a special dedicated 30 million just for projects for low and middle income countries to deal with these chronic non-communicable diseases. We're looking at vaccines. We're looking at the women's health perspective and needs from novel vaccines. We're looking at adverse drug reactions, so specific research in adverse drug reactions that really look at the women's perspective. And finally, there's a lot of work going on AI, but how to make sure that AI in predictive biomarkers also looks at the female cell, what is happening in your cell itself. So these are loads of examples on how we are already working and financing women's health. And this is also a call for action to you, because we have put up the project topics, and now we are looking for project applications. We are looking for project applications. So this is the call for action. If you want to have women's health funded in the EU, you better get your project application in. We also are looking for very good evaluators to evaluate these projects. So again, call for action. If you want to get involved, become an evaluator of our programs. And finally, we have many, many ongoing projects that have a real outreach to, in terms of prevention, but also in terms of clinical studies. So and we are actively, these clinical studies are actively recruiting women. So they need you, they need us to participate in their clinical studies. Now, a second part is about what is going to happen in FP10. And I'm very happy about the combination of ECF and FP10. I see that this has given us a much more integrated approach to health, because what we've done is we have combined a number of siloed, maybe a little bit siloed programs like EU for Health and Horizon Europe, and we have integrated this into a single window. And that, I think, will have a real benefit for women's health, because we can move from prevention to vaccines, to discovery, to treatment, to supporting healthcare systems. Before that, it was a little bit siloed, and especially the starting point and the implementation point in regional and local healthcare settings, we are missing that. But thanks to this integration in the FP10 ECF, I see that there's a lot of opportunities. You talked a little bit about competitiveness. Now, I think this competitiveness is also an opportunity for women's health. Not only because, as you said, healthy women are women that are involved in the labor market. Healthy women are entrepreneurs. Healthy women are more productive. And there's a huge interest in healthy women and treatments for from the pharmaceutical industry. I also see that even a number of national governments are setting up women's health innovation programs, including Ireland. So I think that is really something to watch out for. What does it mean to invest in women's health from an entrepreneurial, from a startup perspective? Yeah. I also see that not only ECF, but FP10 are opportunities for women's health research, but a lot of the women's health can also be funded through the new Agora EU. And I'm sure that you and your committees are aware of what is happening in there. Now, as a final 3 minutes, you mentioned how do we also look at the intersectionality of women's health research with socioeconomic status, disabilities, ethnicity, and migration background. And this is really very close to my heart. In my own team, I have social scientists and health researchers. And we have really tried together with our member states and with our stakeholder communities to cross that bridge. It took us a little bit of time, but I can give you 1 or 2 examples what we're doing in Cluster 2, in the social sciences part of Horizon Europe. So you're watching the social sciences partnership, where, for example, we have a topic on health and migration. So health and migration, because we see that there's a lot of changes in the health status of migrants. We're also looking at what does it mean to rethink long-term care policies. So what does it mean in the future to give long-term care? Who is most affected by that? And we're also looking at the improving socioeconomic outcomes for persons with dementia and informal caregivers. And the informal caregivers are often us as women. So how can we better support and maintain the well-being of these very, very long-term caregivers, informal caregivers? I was asked about how do we monitor ensure that women's health is treated as a cross-cutting priority across all Horizon Europe clusters. The open and frank answer is that we don't monitor this. We do not monitor this. This is not an obligation for the European Commission to monitor. We have other obligations, other non-financial obligations, such as the social sciences and humanities, where we look for the integration of that. But again, we are at the beginning of negotiations of the next framework program and the next MFF, and it's in your opportunity, in your remit, to ask for these kind of things together with the other co-legislators. So I think, to conclude, I think this is an excellent timing to be there today. There are many opportunities. Across a number of MFF programs. You have, as MEPs, you have shown us that you have delivered on 5,000 amendments for the previous Horizon Europe program. So I don't know whether that's a good target, but I do think that it is really a way of making sure that all these programs have the best and reflect the best needs, including those from women's health in Europe and beyond. Thank you.
Thank you very much, Henrietta van Eel, for giving the Commission perspective, particularly in the area of research and the multi-financial framework. And I suppose the need for us to keep prioritising innovation and funding in that particular area. Now, we now go to the second section, EU Women's Health Strategy Overview and EU Coalition for Women's Health. Peggy Maguire, I think, is online. So, hello, Peggy. How are you? Peggy's
hello,
coming
Mr. Kelleher.
You're coming in from Ireland. I hope everything's going according to plan so far, is it?
I think so. Can you hear me?
We can indeed. Peggy, the floor is over to you. So building and mobilising the coalition. Over to you, Peggy.
Thank you very much, MEP Kelleher. I'm really sorry I can't be with you this morning, but unfortunately, due to ill health, I couldn't be there. But I'd really like to thank a number of people for making this day so successful, because there's so many people in the room, particularly Heidi Siller, who is there today organising everything, and her colleague Maria, who is there to support her. Of course, MEP Kelleher, who is always supportive of women's health, and our board members, Miriam Memsholer-Osak and also Rutger van der Gaag. It's great to see you all here, all our strategic partners and critical friends in the room, but also hello to everybody online as well. I'd like to say a particular hello to Jennifer Gillivan and Heather Crichton from Canada, whom we've been working with over the last number of months, because they're working really strongly to have a similar type of activity in Canada, and doing it very, very successfully. Also like to say hello to Joan Bulger and also Cara from the Irish Global Health Network. We worked with the network and also Women in Global Health in November to have a very successful two-day conference on women's health. And from that came the Dublin Declaration. And of course, we have somebody in the room today from Women in Global Health, that's Paula Quigley, who will talk more about that later. But you will receive all of this information after the event. So first of all, I'd say it's great to be here, and it's great to arrive at this point. Women's health has often been framed as a specialist niche issue, but in reality, it sits at the heart of equality, resilience, and Europe's future competitiveness. Across the EU, women experience health differently across the life course, yet our systems, data, and policies still don't consistently reflect that. So what brings us together today is a shared recognition that this gap is no longer acceptable, and that coordinated EU action is both necessary and also possible. Today, I'll briefly outline how we got here, what the strategy sets out to do, and how the partnership turns ambition into delivery. Women's health is not a niche issue, it is central to Europe's future and competitiveness. Next slide, please. The journey has been deliberate and collaborative, building momentum step by step. And what you see here is a growing coalition of political and societal commitment. This is momentum, and it's not bureaucracy. So in April 2024, as Miriam said, we had our manifesto for women's health prior to the EU elections, and we had wonderful support. Over 40 organisations supported that manifesto. And it set out clear call to action ahead of the EU elections, calling for an EU strategy for women's health. It created a shared political and values-based foundation for everything that followed. The manifesto turned concern into commitment. And then in January 2025, there was the relaunch of the Women's Health Interest Group. Tilly Metz, Stine Boss, Serpa Pietikainen and Romana Jerkovic, who are the co-chairs of the interest group and are working very strongly and consistently on making women's health outcomes better at a European level and through improving women's health policy. I think the creation of this group sent a strong signal that women's health transcends party lines. It anchored the agenda firmly within the European Parliament, and women's health has cross-party political backing. And then in March 2025, the strategy development began. From the outset, stakeholders shaped the scope and priorities of the strategy, and this ensured it reflects real needs, evidence, and policy realities. The strategy was co-created, it was not imposed. So in April to May 2025, we had our consultation on content. A wide range of voices contributed to refining the strategy. This strengthened both its quality and its legitimacy. And broad consultation does strengthen ownership as well. In June, we had a final consultation webinar meeting, and this was the moment of consolidation and shared ownership. With the strategy now final, the focus must move decisively to deliver. Strategy is finished, delivery must begin. Next slide, please. So women experience health differently due to biology, social roles and demographies. Yet policies and systems still fail to respond adequately to these realities. It's improving, but we have a long way to go. The gap between need and policy is no longer acceptable. The guiding principles of the strategy and all of the partners involved is a life course approach, and intersectionality approach is essential if we want equitable outcomes. Collaboration and knowledge exchange are what makes this achievable in practice. So equity requires a life course intersectional approach moving forward. So in the strategy, next slide please, I'm not going to go through all, we have a set of recommendations and there's quite more than what's there, but I'll just briefly summarise them. So women's health research has been historically fragmented and underfunded, as we know, but it's great to hear Henriette talking about the billions that are going into gender and women's health at this point. Intersectional impact assessments help us design better, fairer policies, so better evidence leads to better policy. So also we're looking at sustainable funding. Without all strategies fail if they're not resourced and politically supported. So we know that under the multi-annual financial framework, we know that health has come under competitiveness. But I don't think this is a problem. I think women, healthy Europe. Women are very strongly part of the labour force, and they should be encouraged more not to be left behind and they should have more access to the labour market. So also, next slide, please. Also, just one more thing about, I think, mentioned education. I know with, I think Anna mentioned education, that it's not a national, an EU competency, which we know, but maybe we could work through something, Anna, from the Bologna Agreement. But also the Institute has been working with AME, the Association of Medical Education in Europe, to make sure that they are aware of the gender and women's health issues and to encourage undergraduate curricular development, including women's health. So most of the reports, I think also this reflects the divergence of the supporters and our partners in this strategy. The key priorities that have come up are immense. They're all life course, and they are really immense and need to be widely disseminated. Addressing key health priorities for women, which include across the life course, maternal, sexual and reproductive health, cardiovascular, cancer and chronic diseases. And it's great to know that we now have a cardiovascular plan and that women have been mentioned in it, because it is the #1 killer for women. And really women need to be specifically focused in in the plan. And also the EU Beating Cancer Plan, another flagship, which is excellent also. I think we need a stronger, content for women in that plan. I know it's been recently reviewed, but I think around the next time we really need to look at that to see how we can strengthen the women's position there. And also mental and neurological health, that is such an important issue. across the life course as well, and one I think that's been neglected. So brain health, mental and neurological health really needs to be emphasised. So, and also the infertility and assisted reproduction is a huge issue for women as well. Next slide, please. And also digital transformation must not repeat existing gender biases, as has been previously said. I mean, the information in the digital world, AI, etc., is only as good as the information that's put into it or the algorithms that are used. So women need to be at the table when AI and this type of digital research is being done. Otherwise, there is a danger that we will fall back again and increase inequalities. But also, at this point in time, I think it's such an important issue with AI that we've seen such publicity over the months that we really need to be careful, and we really need a stronger voice at a European level when it comes to promoting gender equity in the digital transformation for equality. Thanks. Next slide, please. So we're on to now the vision and what work are we going to do? The strategies here, but we just don't want it to be a strategy. We want to deliver, and it is a delivery mechanism for the EU Women's Health Strategy, this partnership that we're proposing. Women's health is cross-cutting, it's not a niche priority, and women's health cuts across resilience, competitiveness, prevention and demographics, making it structurally relevant. So the partnership is designed to deliver, not just discuss, and it recognises that women's health cuts across multiple EU priorities. This is a delivery mechanism, not a talking shop. So next slide, please. Momentum already exists at a European level and a national level as well, as we see with the Women's Health Interest Group, with work with MEP Kelleher, and that he's doing, and the FEM Committee, and also the Sant Committee as well. The roadmap for women's rights, gender equality strategy, etc. So we also have very good national strategy emerging from Europe as well, like in Austria and also in Ireland, where I co-chair the Women's Health Task Force in the Department of Health. And this is very much centred around women's voices and creating action plans based on the priorities and consultations with women across the life course on different geographic locations across Ireland. So I think we need to be looking at that as well, that how we can align the EU-wide alignment that's going on at the moment. I think Ineke Klinge, one of our participants online, said there's an awful lot going on in the Netherlands, which we know about because we've been talking to them. There's work going on in Germany, and I think even somebody mentioned Romania as well. So I mean, there is huge opportunities there moving forward. Next slide, please. So I won't go into, because I know I'm probably running over time at this stage, but the partnership provides a united and credible platform for action. It supports implementation, coordination and monitoring across all levels. Collective action delivers greater impact. Next slide, please. And the aim is concrete policy impact, not abstract commitments. An EU communication and council recommendations are critical next steps. And this is about policy change, not statements. We also hope to have some input into the Irish presidency also this year, at the end of the year. So how will the partnership work? Next slide, please. We hope that the structure will be independent, transparent, and also expertise driven, because all the people who have signed up to the strategy and contributed are all experts in their own right. It complements and strengthens Commission action. The partnership strengthens EU policy making capacity. The success will be measured by delivery and outcome. I think this is important, that we're monitoring and we're actually measuring delivery and the outcomes. Clear work plans and monitoring ensure accountability. Delivery is the measure of success. So just to end off now, the strategy shows there is consensus on what needs to change. The partnership is about making sure that change actually happens. Women's health cuts across prevention, workforce sustainability, innovation and demographics, making it structurally relevant to Europe's future. The opportunity now is not to create something new, but to align, connect and deliver better together. The partnership is now an open invitation to policymakers, civil society and funders to move from commitment to measurable impact. The question is no longer whether women's health deserves coordinated EU action, but how quickly we are willing to act on it. So the question is not whether to act, but how quickly we can do it. Thank you very much.
Thank you very much, Peggy. Really appreciate that. And best wishes. Now we go to Melanie Hyde, World Health Organization, Euro, Gender Equity and Human Rights. So Melanie, over to you.
Thanks very much, honourable members, colleagues and friends. Thank you for the invitation and for your leadership in hosting this launch today. I'm Melanie Hyde from WHO Europe, and I'm really honoured to be here at the launch of the EU Women's Health Strategy. As I find myself and hearing others continually saying, this is about the health of over half of the population. Next slide, please. 10 years ago, in 2016, 53 health ministers of the WHO European Union approved the strategy on women's health and wellbeing, which was a landmark commitment that many of you, including the European Institute of Women's Health, helped to champion. And today, a decade on, as we reflect on 30 years since the Beijing Platform for Action and look towards the Sustainable Development Goals for 2030, we see that progress is too slow, and the ferocity of the backlash on women's rights threatens the fragile gains we've made. As many of the speakers have said today, the evidence is stark. Women spend a larger share of life in poor health, from sexual and reproductive health to maternal health to non-communicable diseases, mental health, aging and access to care. Women face unique and often overlooked challenges shaped by biological, social, economic, cultural, commercial and environmental determinants of health. And these structural inequalities, systemic gender bias in health and research, failure to include sex as a biological variable in preclinical research, underrepresentation of women in clinical trials, lack of research on sex-specific health conditions, results, as many have said, in underdiagnosis, misdiagnosis, dismissal of pain, delayed treatment, and poorer health outcomes for women. Data gaps and biased design continue to ripple through diagnostics, therapeutics, and digital health, including AI. Next slide, please. So what are we doing about it at WHO? Well, under the second European Programme of Work, which takes us until 2030, and was unanimously adopted at the Regional Committee last year, our actions span across 5 priorities that can directly support women's health through a life course, rights-based and accountability-driven approach. Health security, non-communicable diseases and health drivers, healthy aging, climate health action and health systems. We also have 2 special initiatives, strengthening primary health care and strengthening the health response to violence against women, reflecting the most urgent needs in our region. Next slide, please. We need to remember that violence against women remains a public health emergency. Our new report shows that almost 1 in 3 women in our region experience intimate partner violence and or non-partner sexual violence in their lifetime. Next slide, please. And at the same time, less than 40% of the countries in the WHO European region have the minimum services recommended by WHO for post-rape care in policy. Next slide, please. This has an enormous impact on the health of women. Intimate partner violence is one of the leading risk factors for women's mental health, depression, anxiety, self-harm. We also have a rise of technology-facilitated violence against women and girls, which is moving at a pace that we are all struggling to keep up with. Next slide, please. WHO Europe's role is technical and practical. We are a partner. We are setting evidence-based standards and norms, supporting implementation and enabling comparable measurement that helps countries to align investment in health and research with the disease burden for women. A key enabler of that is the Health Equity Status Report Initiative, which maps data and trends in health status and equity across 5 essential conditions, regionally and sub-regionally. The second report due this year updates indicators and includes a greater focus on the conditions that drive health inequalities for women, sex and gender discrimination and violence, income insecurity and social isolation, living conditions, unpaid work and the burden of care, social and human capital, disability, living with a limiting illness and access to quality services. Our data shows that on average, across the life course, women still report poorer self-rated health than men. And among young women aged 16 to 24 in the lowest income quintile, bad or very bad health has more than doubled since 2012. WHO Europe's comparative evidence can help countries to target scarce resources and frame health not as a cost, but as an investment in the future. We can also show, for example, how gender-responsive policies and investment targeting women, say in the 45 to 64-year-old bracket with affordable healthcare, pensions and other social policies, reduces by half the risk of poverty and poor health of women when they become 65 plus. So this kind of unique modelling is something that we're looking at in terms of bridging the gaps and breaking down the silos. Next slide, please. We know that closing the health gap is really complex, but not impossible. And we continue to support countries to transform structural gender inequalities and tackle the root causes of harmful gender norms and power structures that affect women's health. Through, as many have said, strengthening evidence on sex, gender and health in clinical and public health research, and translating that knowledge into actionable gender-responsive health solutions across the life course. The new EU roadmap for women's rights, all the action plans, the strategies on social rights, fairness, poverty, and those currently under development, and the strategy launched here today give us an opportunity to come together to make all these promises a reality. Each of us has a unique role to play, a specific mandate, our own governance structures, our own challenges. But now more than ever, we are compelled to focus on what unites us, our commitment and desire to close the women's health gap. And I believe that with strong partnership, with collaboration, we can move from strategies to measurable equity, honouring the right to health for the 51% of our population. Thanks very much.
Thank you very much, Melanie. So that sort of brings the conclusion to the first session. We'll now hand over to Professor Ruther van der Gach. Yeah? Yeah. Spent a bit of time in the Netherlands 40 years ago, so always had difficulties with the G's. But so co-chair of the European Institute of Women's Health. So we'll have just the first discussion around women's health strategy expert partners, and then obviously Professor will moderate the questions and answers. So over to you, Professor.
Thank you very much, and good morning, everyone. This session is about moving the European health strategy forward, not as a concept, but as a shared practical agenda for action. We've spent the morning discussing why, and now we have to really focus on how to make the strategy work in practice. One of the most powerful aspects of the strategy is the breadth of the support behind it. The partner organizations and individuals whose logos you've seen on the strategy represent a truly European and beyond coalition, spanning policy, healthcare research, civil society, and lived experience. Those logos are not there for visibility alone. They reflect real contribution, real expertise, and real commitment. Women's health is not a single issue. It cannot be addressed in isolation. It cuts across the life course and across policy areas, from prevention and research to employment, addressing social determinants and ensuring social protection, protection against violence against women, and addressing healthy aging issues. The complexity is precisely why partnership matters. Progress depends on collaboration, coordination, and willingness to work across traditional silos. In this session, each of our partners will have a very brief opportunity, just 1 minute, and I will have to stick to that, to share why the EU Women's Health Strategy matters from their perspective and what they see as essential to moving it forward. Together, these voices demonstrate both the urgency of the challenge and the momentum that already exists. So now I'll introduce the partners one by one, and I won't be too harsh, but 1 minute is quite short, so be poignant. Elizabeth Schuiper is the resident of the European Policy Centre. The floor is yours.
Thank you so much, Rutger, and thanks to all of you for being here as well as online. I think today shows again that women's health is not lacking ideas. It's lacking skill, coherence, and political prioritization. And therefore, it's been said, it's an important opportunity to have indeed a women's health strategy to ensure that indeed research, funding, health delivery, but also data are being combined. And I think especially the last point, and Peggy pointed to it, especially in light of AI, without data, we're policy making in the dark. And the reason why a women's health strategy is so important is not because it's a niche strategy, but it's really because women's health is a question of equality, economic resilience, and social justice. And therefore, I'm very happy, and I would like to congratulate the Women's Institute of Health, and especially Peggy for being such a force of nature to driving this agenda. And I would like to call on all of us to really work together and to ensure that we maximize impact by working together. Thank you very much.
Wonderful. Thank you so much. I hope I pronounce your names correctly. Bonja Santic from Fertility Europe.
Thank you. So what we endorse the most is the fact that the strategy reframes fertility and infertility in a structural way. This means that we endorse recognition of fertility and infertility as women's health issue and as a gender equality issue. So what do I mean by that? Fertility and infertility are still perceived either as a private issue, either as a marginalized issue, even though infertility affects more than 25 million people in the EU as we speak. And if you were listening carefully for the first hour of this event, infertility was mentioned only once. So despite those huge numbers, the stigma is persistent. And to finish, why it is a gender issue? Well, infertility affects both women and men in equal measure by diagnosis, but it is experienced differently. It is the women who are under the toll of infertility treatment because it is the women who experience the physical, emotional, and financial weight of the treatment, even when it is a man's diagnosis. So we feel this is an opportunity to address those issues. Thank you.
Thank you very much. Now we move to Dr. Anna Rosemilia, President of the International Urogenital Association.
My name is Anna Rosemilia. Thank you. I'm Australian, but I'm the child of European immigrants and the president of the International Urogynecology Association, which represents more than 3,000 clinicians worldwide. So this strategy for us creates a transformative opportunity to finally embed pelvic floor health into mainstream women's health care. 1 in 4 women live with pelvic floor disorders, prolapse, urinary incontinence, bowel incontinence, perineal trauma, and sexual dysfunction, many originating in childbirth and compounded by menopause and aging. And the opportunity here is prevention rather than late rescue. With this strategy, Europe can normalise early screening after birth. It can establish clear referral pathways, formally recognise urogynecology as a subspecialty, and invest in research and low-cost interventions that prevent decades of disability, of social isolation, and workforce loss. It also allows us to measure what has never routinely been measured, maternal pelvic morbidity, and therefore improve quality of life, economic participation, and healthy ageing for millions of women. The European Parliament, we thank you, can make this opportunity real by championing the implementation of that funding and cross-member state consistency. Thank you.
Thank you very much. Now we move to Fionn Storer-Jones from the Deutsche Stiftung Weltbevölkerung.
Thank you very much, and congratulations to Peggy, and a pleasure to cooperate with the European Institute of Women's Health on the launch of this document towards a strategy for a EU strategy for women's health. We are delighted to see the international and European dimension highlighted in the strategy. We see the EU, particularly now in this current geopolitical environment, as a well-placed actor to push the agenda of women's health, both within and beyond the EU's border. Thank you. Ooh. That was a minute. There we go. If I may, 10 seconds, we would really like to see the conversion of the demands in this document be reflected in the future multi-financial framework by ensuring that women's health really is a priority across the research programs and the external action programs.
Thank you very much. Paula Quigley from the Women in Global Health and Irish Global Health Network.
Thank you very much. Good morning, everybody. Yes, I'm representing Women in Global Health Network, a global platform for gender equality, which has an Irish chapter, but also has many European chapters. And we all work together across the EU to promote on a European basis. I wanted to just highlight the event that Peggy mentioned, which was the event that we held in Dublin a couple of months ago. And it was funded by the EU and hosted by our partner, along with the European Institute of Women's Health and Women in Global Health, the Irish Global Health Network. And this came up with a policy brief and a Dublin Declaration, which you will all be receiving the link to and after this event. The purpose is to give more tangible action points to the Irish government, no pressure Billy, when it takes over the EU presidency in July this year. But of course, not just for Ireland, but for all of Europe. And we hope it will be a tangible tool that will support the women's health strategy in Europe and help our European partners really to implement these policies and move to action, as Peggy has so eloquently said. Thank you.
Wonderful. Thank you very much. Alicia Delano Núñez Cortés de la Fundación Gaspar Casal.
Thank you so much, and thank you, Peggy, and congratulations, everyone, on this EU strategy for women's health. I came representing the Gaspar Casal Foundation, we're a Spanish health think tank. We have developed a health map with perspective. We show the status of women's health in Spain. We also integrate 8 socioeconomic indicators because we are very committed with data-driven decision-making, and we are very pleased of the opportunity that this strategy sets up with the necessity to strengthen data and research and to prioritize women's health pathologies. I think if we all could work together in this alliance, thanks to the European Institute of Women's Health, it would be, from our point of view, very useful to try to evolve this map at the European Union level. Thank you so much.
Thank you. Now we move to Antonella Cardone from Cancer Patients Europe, and she's online. No, she's here.
So thank you. And so from the cancer patients' perspective, we believe that the strategy is very important, is very timely, essentially because of the discussion now on the MFF. We also applaud the work done by the European Institute of Women's Health. I mean, this already it is a success to have so many different perspectives united around one common strategy. And specifically from the cancer patients' perspective, it is important to consider that for instance, one aspect that is very close to our heart is the involvement in clinical trials of essentially men. And when it comes to cancer, identifying the right dose of treatment for women would also have an extremely high reduction in cost, not only on the quality of life of a woman, but also on the society. As side effects of cancer treatment and overdose of cancer treatments have a huge impact on the society. So thank you.
Thank you very much. Then we move to the Young Women's Health Group, Flavia Chiavelli.
Thank you very much. I speak today as co-chair of the Young Women's Health Group, an initiative supported by the European Institute of Women's Health. Our group was formed with a simple but vital mission to bring forward the voices of young women whose needs are still too often deprioritized in policy discussions. Our presence here is grounded in the understanding that health is political and that young women's health must be recognized as a political priority. Among the many difficulties and injustices that have shaped women's health, young women remain a systematically hidden group caught in the double bias of being both young and women. This attitude is visible in the mixed messages society sends us. We spend half of our teenage years being warned about unplanned pregnancies, and then almost overnight, we're expected to understand everything about our fertility and to know how to conceive as quickly as possible. These contradictions are why this strategy is fundamental, as it helps us address the challenges we've understood are key in improving young women's health, such as an intersectional and holistic approach to menstrual health, with its inclusion in medical research and clinical trials, improved access to contraception, and more development in R&I that includes young men, and an implementation of a comprehensive sexual education. We thank the Institute once again for inviting us to help shape these priorities, and we look forward to working with you all through the Coalition of Experts on Women's Health to ensure that these are really acted upon. Thank you all.
Now we move to the International Midwives Association, Daniela Drunchik. Well, delivering, I suppose. Then we go to Iona Banach, endometriosis.
Hello, everybody, and thank you. We women are often expected to do the impossible, so please forgive me if I cannot answer 3 questions in 1 minute, but I promise it won't be more than 2. I represent the European Endometriosis Alliance. These are patients' organizations, sick women caring for sick women across Europe. Endometriosis is a systemic chronic condition that causes extreme pain. That's why it's important that I breathe right now. It also causes fatigue, it causes disability and infertility in many of us. 14 million women suffer from endometriosis across Europe, but it's not just us suffering, it's also our partners who are caring for us. It's our children who grow up in households with unmanaged pain, and it's our employers in our economies as well. 30 billion euros are lost every year only in the EU to endometriosis. Just to put it in perspective, that's nearly a fifth of the entire EU budget. And yet, even if the scale is so big, it takes us on average 7 to 10 years to receive a diagnosis. 7 to 10 years in debilitating pain before we get an explanation. And when the explanation comes, there's no cure. And treatment differs greatly in quality from country to country, from hospital to hospital. And if you're a Roma woman or any minority woman, the issue only grows more and more complex. Endometriosis is not a niche condition. So we argue that this delay in diagnosis is not just medical, it's also political. So what can this strategy do for us? I say 3 quick things: inter-country research and data. One of the greatest specialists in Belgium said it, we are 50 years behind on endometriosis research. Let's catch up. And I'm delighted to see the European Commission research DG being in the room. Number 2, we need workplace protection and social protection. The EU is on champion on workers' rights. Let's do that also for endometriosis patients. And number 3, we need also awareness and education. I know the EU has limited capacity, but I really think we can do a lot around awareness, because a lot of the diagnosis delay is also because of that. And I was also asked to say what's one challenge to look for at national level implementation. Let's match the scale of this problem with the resources and not just put peanuts on it. And 2, listen to patients and patients' organization. That's what you have done today. Thank you. We are super excited to support you in any way we can. Thanks.
I have to apologize because Daniela seems to be online. Daniela, are you there? She cannot unmute. So then we move to Shireen Cindy from the Center for Alzheimer Research.
Thank you very much again for formulating an excellent strategy. I'm an associate professor at Karolinska, focusing on sex-specific reproductive and hormonal risk factors for Alzheimer's, a field that has really been underfunded and underinvestigated. One area we would like to really highlight is really the need for funding. For example, in 2024, it was highlighted that only 5% of global R&D has been spent on women's health research, 4% of it on cancers, and 1% for all other health conditions. So it's really excellent that the EU is pushing this forward and prioritizing this. One thing I would also like to hear from you is how you will ensure that this will be long-term sustainable funding, both in terms of new calls specific to women's health, but also how you will integrate it in existing calls. So once again, thank you to the entire team for your efforts in this area.
Thank you very much. So now we move to Silvia Gonzarela from EuroHealthNet.
Yes, thank you very much. EuroHealthNet is a public partnership with public health authorities. At the core of our activities is health equity and health promotion. Thank you for co-creating the strategy also with us. I think it's very important that from co-creation we go to co-implementation. So it's great to see all these stakeholders around this table making a commitment. At the moment, at European level, a specific initiative, comprehensive with all the policy looking at women's and health is missing. So the time of this strategy is perfect. We really need to have one and to act upon one. Three maybe recommendation. It's important that in the implementation, we keep a strong focus on health promotion. We can start already in school. It's important to show that it is possible and it will bring benefits for all society, not only for women. So we need to have good practices, build the capacity, raise the awareness on what we need to do. And then the third point is we need to connect all the policy, all the sectors. So we need to have women's health concerns in the European anti-poverty strategy, in climate and health, in employment, because there's a strong dimension that can help women to improve the health in these sectors, but are not the obvious choice when you think about women's and health. Thank you.
Thank you very much. And we are partners in EuroHealthNet. I can see Daniela. Can we hear you?
Yes, thank
The floor is
you.
yours.
Daniela Drandich from the International Confederation of Midwives. And thank you to the speakers and partners who've come before me, who've so eloquently outlined the pushback on women's health and rights and the issues that women are facing across the life course. And those enormous implications that many of you have spoken about that these have for our societies and for the EU. I come to you with a cost-effective, proven solution that can make a huge impact on women's health and well-being: midwives. Midwives do more than catch babies. Midwives educated and enabled up to the level of the ICM Global Standards for Midwifery make an enormous, cost-effective, and proven impact on sexual, reproductive, maternal, newborn, and adolescent health. But many member states put restrictions on how and where midwives can do this critical work. Why? Because they don't actually prioritize women's right to health. And we can't prioritize women's right to health without prioritizing midwives. The EU has many levers on which it can deliver on women's health, prioritizing women's health throughout financing mechanisms, gender equality, research priorities, climate work, innovation and competitiveness, and free movement of a competent health workforce that impacts the quality of women's health services. This strategy gives us the tool that we can use to move from politics to action, and ICM is ready to be a critical partner in this work. Thank you.
Wonderful. Thank you very much. And I'm glad we got in touch with you at the end. What we've just heard is very clear. The case for a EU women's health strategy is strong. The evidence is compelling, and the support is already there. What is needed now is focus, follow through, and political will. Moving this strategy forward means turning shared priorities into concrete actions, embedding women's health into EU funding, research agendas, health systems, and equality frameworks. It means ensuring accountability, measurable progress, and sustained collaboration across institutes. I apologize. It's a collective call to action. The opportunity is here, and I open the floor for a quarter of an hour to any remarks that you would want to make. I hope my voice will come back.
Thank you. Make Mothers Matter. So we are also signatories of this strategy, and we would like to acknowledge the inclusion of the ask for high quality maternal health services. We would like to see that extended also to maternal mental health. The strategy also acknowledges the women have higher rates of mental health disorders and the impact of care work on maternal mental health and in general in women. But we know that most of the unpaid care work around the globe is made by mothers. And we know also that motherhood is not a temporary condition. Motherhood goes beyond maternity leaves, and still mothers have to juggle everyday work with care responsibilities, with gender norms being practically inexistent, pressure in there, and support being practically inexistent. Our survey of almost 10,000 mothers around the EU and the UK in 11 countries of the EU, including Ireland, show us, our mothers said that 50% of them suffer from a mental health condition, means depression, anxiety, burnout, perinatal depression, and 67% are overwhelmed. And this doesn't change so much within the brackets of the children. We asked from 0 to 17, 4 categories of children. So it's not really linked to motherhood, maternity during the first 1,000 days. We also think that it's important that all this comprehensive approach to maternal health involve all vulnerable groups, of course. We have mentioned migrant, the poverty of vulnerable women, and that mental health is embedded in these systems. Just one number, the gender pay gap in sick leave starts with the arrival of the first child and can go until 8 years of age of the woman. So just thank you.
We move to Friso Coppens from Bureau Brussels.
Now, rather here for everybody, an NGO that we support. It's all man coughing here. For the last 6 years, and I have two. We're very much in support of all this work, of course. We're doing this for 6 years now, and I would like to share 2 lessons or suggestions that we have learned. Calling for sympathy for a women's interest is an uphill battle. It started with an apple and a snake, and it hasn't changed yet. It's terribly difficult. Even in progressive circles, if you come to it, it's merely women. That is why we changed our approach. We don't talk about, well, by the way, we do studies. One you may like to read, it was published in the British Medical Journal under the title, What Every Doctor Should Know About Women's Healthcare. But with that, you don't get across. So we made it an economic approach. It was mentioned earlier this morning. Mister, this is not so much about women. You make a loss here. Or better still, there is something to be earned. We have developed a formula that even indicates at a level of a company what the profit can be if a specific disease the woman is suffering from is treated properly. The second, so make it an economic story. Otherwise, those men will not listen, I assure you. The second is, it was your late colleague, Veronique Triet, MEP Renew. She passed away last year, doctor by training. We had a conversation with her, and we were dreaming of a figurehead, an ambassador of our initiative, and in brainstorms names like Michelle Obama and so. And she said, no, 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 not a woman. You need a man. And of course you do. Otherwise, it's yet another one coming, complaining and whatnot. So, by the way, Irish, we did succeed. Your former Prime Minister, Leo Varadkar, accepted to be our ambassador. That's not just for Care for Everybody, for everyone to enjoy. So 2 suggestions. Make it an economic challenge. There is something to be earned, and bring the message, get men on board. Thank you.
Thank you very much, Friso. It's very much in line with Margaret Thatcher's strategy, who always said, if you want to have something said, ask a man. If you want to have something done, ask a woman. The floor is.
Thank you very much. Alina Pavel on behalf of the HIV Prevention Alliance. We represent about 27 organizations of groups at risk of HIV and STIs, including women in all their diversity. We would like to congratulate the Institute for the launch of the strategy and pulling all the amazing energy in the room, and all the partners for bringing all these important issues at the table. Women are over half of the population, so women's health should not be treated in silos as it has been for way too long in history. The HIV Prevention Alliance has co-developed the strategy together with the Institute, and we would like to highlight our contribution. We included the increased risk women face to contract HIV and STIs, which have been on the rise in Europe in the past few years, including because of gender-based violence. And we also highlight the unique impact of women on their health when they live with HIV in the long term, an issue which has been given little attention by research and clinical communities in the past. So we very much support EU action on all these intersectional issues, and that should integrate sexual health and reproductive rights, including HIV and STI prevention across all policies. Thank you.
Thank you very much. I must highlight that there are more than 20 questions that were put in by people online, and we'll answer all of them in writing. It's not possible to have it here. There are still some more speakers. Yes?
Good morning, all. Barty Shivalka, cardiologist. I really liked what you said. Women's health or women's diseases shouldn't be treated in silos. We've heard lots about endometriosis, fertility, cancer, etc., etc. I feel as if I'm the lone warrior here, talking about women's heart health. What I'd like to point out is when you look at women's health across the life course, there are so many issues that affect women that actually finally culminate into cardiovascular disease, causing really the highest cause of death in women is cardiovascular disease. The most recent EU statistics show about 40% of the deaths in women. And of course, we don't talk about the geographical disparities, the East European countries where it goes up to 58, 60% of women dying of that. So my plea here would be, let's not work in silos, let's all work together and create that awareness, that life course awareness about where women suffering from, let's say, endometriosis at a given point in time, pregnancy-related complications, and so on, where are they ending up? So let's work together. And there are cardiologists here and there in different countries that are really working almost alone. And that's why I use the term lone warriors. Female warriors exist as well. who are trying to working together with gynecologists and general practitioners, primary care level, where we need to create that awareness to work together and educate. And spread the word about how it affects women, and educate not just the physicians, but educate women at large at societal level as well.
Thank you very much. It's worth mentioning that in the Netherlands, there's a coalition between cardiologists, psychiatrists, and gynecologists. We have 2 speakers here and 1 over there, and then we'll go back to, and 1 over there. Yep. 4 speakers, and then we'll go back to our deputy. There you go.
Good morning, good day, everyone. My name is Clarissa Iordache, and I represent the endometriosis patient organization in Romania. Maybe you are wondering why it's so important, and we insisted on helping us also on endometriosis issue. That was included in this strategy presented today. I will give you 3 examples specifically for Romania. Romania has now only 3 private endometriosis centers for treating this disease. And women with advanced endometriosis has no equal chances to be treated in a public hospital. This leads for many of us to a delay in diagnosis, almost sometimes 20 years. Imagine 20 years of pain, excruciating pain, 20 years of other health problems caused by endometriosis. Also, this is a problem because there is the lack of research in endometriosis and the lack of education for the specialists creates this kind of gap. Also, endometriosis has, as a social gap, creates inequality of chances in education, creating a family, working, and also economical problems in Romania or even any other country around the globe. As long as endometriosis isn't a priority at the European level or also international level about equality of chances. Thank you.
Thank you very much. And you have a collaboration across the table. The floor is yours.
Thank you. And thank you very much for all the work that went into this strategy, which we very much welcome. And FANSA is a signatory as well. We are the European Federation of Homelessness Organizations, and we welcome the particular focus on the social determinants of health, including the housing, but we would like to add homelessness as the most severe form of social exclusion and housing exclusion. And why is it important? Because of the severe health consequences of the experience of homelessness, which is even worse for women. Just an example of the extreme health inequalities homeless women experience. The average age of death for women experiencing homelessness is 42, which is even lower than the male counterparts, and it's the opposite of the general trends in general population. And homelessness creates access barriers to healthcare that house women don't face. So many of the health issues that you highlighted this morning, homeless women are excluded from accessing those kind of health care. So it's very important that the strategy addresses all women's health needs, and for that, the at-risk groups, as Anna Carla Pereira highlighted this morning, are important to be explicitly included to make sure that the strategy delivers for all women including those most marginalized in Europe. And FANSA is ready to help in the delivery for that. Thank you.
Thank you very much, and for highlighting this very important issue. There's lots of homeless across all our countries, and social determinants are utterly important. The floor is yours, and afterwards, yeah.
So thank you, everyone. And first of all, congratulations to the Women's Health Institute for the incredibly good strategy that has been developed. And thanks to MEP Billy Kelleher for supporting women's health so strongly within the EU Parliament. So I'm representing the International Diabetes Federation Europe, and I would like to second the call for action, which is, not to work in silos. We know that people living with diabetes, most of them will develop cardiovascular disease afterwards. A lot of them live with endometriosis. So having that vision that the woman has to be in the center and not the various conditions, and taking into consideration all the environment that's around them. We know that insulin is very much linked to hormonal fluctuations. So the life course approach that has been taken by the strategy is critically important. A girl developing diabetes will have issues every month in trying to have, their insulin and the blood glucose levels. Then there will be the diabetes pregnancy, which is a huge impact on women and on the children. When a woman develops diabetes, gestational diabetes, they are twice more likely in the child also to develop type 2 diabetes afterwards. Then you have the menopause. So you have that life course approach, which is so important and that needs to be taken into consideration. And I would like to add something that has already been mentioned also. It's the importance of having the woman engage in the development of medical devices. We know that obviously women living with diabetes, they have the sensors, they have the insulin pump, but these devices and the algorithm do not take into consideration the menstrual cycles and things like that. So most of the time, the diabetes is not well managed because they haven't been included in development of the device. So these are only two examples that show how everything is interconnected, and I really would look forward to working with all of you on that too. Thank you very much.
Thank you very much. And the last remark here, the woman in green.
My name is Dr. Rakwiti. I am speaking on behalf of the Endometriosis Alliance of Europe, and this is a word that you've heard a lot today, which is good for a change. I will not repeat what my colleagues have said. I will just highlight one thing, and it goes in line with the call for not working in silos. You cannot speak about almost anything in the female body without speaking about endometriosis. And I really feel that a lot of people don't understand that. It is a systemic disease, which means it affects systems and it affects all systems. You cannot speak about cardiovascular health without speaking about endometriosis, because women with endometriosis have 30% more chance of having cardiovascular diseases. You can't speak about infertility without talking about endometriosis, because it is the highest cause of infertility. You cannot speak about brain health. You cannot speak about menopause. You cannot speak about the immune system. You cannot speak about mental health. You cannot speak basically about any aspect of health without taking endometriosis into consideration. And the Endometriosis Alliance, European Alliance, we are new, but we are here. We're also physically here. There's a lot of us here in this room. We are a group of people who have lived experience, who are also experts in the field. We want to cooperate. We want to participate. We want to collaborate. Use us. Talk to us today, email us, get in touch. Historically, endometriosis has been ignored. We have known about endometriosis. It has been first described in the Hippocratic Corpus. It's 2025. We are nowhere near a cure. We have very poor management options. And all the research points in social sciences, in ethics, in history, in medical history, that the only reason for this, the only reason, is medical misogyny and the lack of interests. We are clever people. We could solve this. We just haven't tried. Let's not make the same mistake. We have a chance now to start again. So please keep this word in mind and work with us on making endometriosis something which is a thing of the past in terms of being called incurable and mysterious. Thank you.
Thank you very much. Now I hand over back to Billy Keller. Thank you so much for hosting. We'll make an exception.
Thank you so much, Professor. Sorry, I just wanted to say that I heard so very interesting interventions of everyone, and something that I repeat that hearing from all of you was data, social determinants of health. Please join us tomorrow. We are presenting this health map with perspective. It's really a public platform that raises awareness through data about these inequalities, all the inequalities that you already talked. It only talks about Spain, but it's really interesting to see just the picture of that. And please, it is at siesta time at 4 p.m. tomorrow, but please join us also here in this building. We will be very much happy to have you in the room to please keep discussing, because I think we should all work together to close this gap, because at the end, improving women's health, as we see it, is a way to improve public health. So I think it's a joint effort for everyone. Thank you so much, and I hope to see you all tomorrow.
Well, thank you very much, and everyone can add it to her and his diary. Now I hand back to our host, Deputy Member of Parliament, Billy Keller. Thank you very much.
Thank you very much, Professor, for moderating that session. Just because we're coming near the end of time, I'm going to call on, I'm going to conclude then after that, but I'm going to call on Signe Boss, a Renew Danish MEP and a fearsome advocate for women's rights and also in the whole area of health research. She's co-chair of the EU Parliament's health interest group. So over to Signe, maybe for as long as you like, Signe.
I will make it very short, and I am sorry that I was late. I was at another event on beating cancer, which of course everything connects when we talk about health. And this morning I was also discussing the whole ECF, the Competitiveness Fund, and how we're going to fund ourselves. And that of course is also an issue in the area of women's health. So a couple of comments. And I will start at the end, and then some of you will have heard it before. I actually find it extremely embarrassing that with my age, I'm 65, there are so many insights when you start talking and understanding things about women's health that I just didn't know. So, you know, just to tell probably some of the younger part of the audience in the room, we really missed out on something here. Honestly, we didn't think that it would be possible that you would have clinical trials or anything that wouldn't include the whole population. I mean, if you just think about it, it's ridiculous. So that's where I stem from. I'm slightly annoyed that this is the situation. I also stem from the situation where my own daughter was diagnosed with endometriosis. I didn't know what this was. So that's where we are beginning to actually understand more and more. And the good news is, of course, and I really, really think that that is really, we need to thank a lot of you in the room here, not us as politicians, but a lot of you who have been voicing this, who have been saying, you know, we have to step up, and please don't slack. Please keep on, because there isn't anything, it's like a piece of, you know, what is it called? Elastic band. You know, if we let go of it, it will go back to where it was. So please continue being loud. We have to, on our side of the equation, make sure that we get in all the relevant areas, and there are many, of the legislations, that women's health is in there. And that should be definitely our promise to you, that we will not let go and we will continue. And if you continue to be loud about it, there is a chance that we will get somewhere. And why do I say this about talking this up? It is because politicians are elected. So if it is not a subject close to the public, it will not be. People that will care about this will not be elected, and then we're back to where we should never have been. So that hopefully be encouraging words to all of you, and let's get some things done. Thank you.
Thank you very much, Sine. Just a final wrap up. Just a few thank yous first and foremost. Firstly, thank you to the European Institute of Women's Health for organising this, but more importantly, putting forward their strategy to the European Union for voicing, and I suppose advocating and bringing so many organisations together. Some about 50 organisations have come together to make this particular presentation happen today. But more importantly, the actual strategy has been outlined by the European Institute of Women's Health. As Stina said, this is a political environment we reside in here in the European Parliament. I'm just going to make a few political observations as well at the end, but first and foremost, just a few thank yous. Firstly, thank you to all the speakers, those in the room, those online. And just to make a few observations. The key issue is here, of course, that have been sort of outlined today was the whole issue of strengthening research, data and innovation, embedding equity and intersectionality across EU health policy, and addressing key health priorities for women. Those recommendations are highly valued, and we will strive to channel them into our own report as well that we are presently drafting. In fact, we have about 24 hours, Beth, I think, to put forward more amendments to that. So we will obviously be taking on board some of the issues that were raised here today and in the context of the actual report itself from the Institute. The Commission's EU Gender Strategy, Equality Strategy from 2020 to 25 designed to outline concrete policy measures for achieving a gender equal Europe, and it is now entering the next phase, which is the 2026 to 2030. There's an expected launch date of next month, and the Commission strategy was informed by the 2025 roadmap for women's rights, with public consultation being held between April and August last year. Now, the political aspects of this. Everybody in this room is advocating. By the way, the reason I didn't clap for any speaker is because I actually have a fractured collarbone. So it is not that any speaker didn't deserve my applause, they all did, but I just have a fractured collarbone and some broken ribs, so it's just a little. But the key issue here is everybody in this room is advocating for equality in healthcare, access to healthcare for women, promoting more research and innovation, and ensuring that there's no obstacles placed on a girl or a woman to go through her life facing barriers that men and boys don't face. In other words, having equality across all sections. The sad and unfortunate reality is these rights are often negotiated. They're often negotiated at political level. Now, I have always said that equality is non-negotiable. But even in the context of debates in this Parliament, the issue of gender equality, equal pay, access to childcare, access to education, access to healthcare, is seen as a negotiating bargain between some political groupings, particularly on the fringes, but unfortunately no longer on the fringes, embedded in the extreme right and very right of this Parliament. These are actual political facts. I don't like to make them overly political, but the point is we can all advocate in this room, but we have to go beyond this room to advocate and to ensure that we insist on these policies that have been outlined, both in the Commission strategy for gender equality, but more importantly, from the point of view of the European Institute on Women's Health, that they become embedded in the administrations of Europe and the member states. Because political parties and governments come and go, and they may change or deprioritize. But if we can embed them systemically into the administrations across Europe and into our way of thinking development public policy, well, then we have a roadmap to take us to achieving full equality in all aspects of gender. And that is my fervent wish. Now, I'm not here on any personal crusade. The only reason I'm on this particular crusade is because I have a stake in this. I have a stake in this. I'm married to a woman. I have 2 daughters. I have sisters. I have aunts. And I just want to see this particular issue of equality being brought to the fore. And I saw my own country for many years that when you start stripping out equality, access to healthcare, access to health and sexual reproductive rights, well, then you put up barriers that can really be detrimental to a person's ability to advance themselves and that of society. So that is my hope, it's my wish, and we're off to a good start in the sense that I firmly believe the whole issue of gender equality, access to healthcare, equality in the workplace and income is something that is coming very much to the fore. But we must continue to advocate, and not just to those that already agree with the principles and the ideals and the philosophy of equality, but to those who don't, and to challenge them. So I want to thank each and every one of you, professor, doctors, speakers, everybody involved in organising this. It's a pleasure to host this. Remember, it's your parliament. We are your representatives, and we're here for the purpose of putting forward meaningful policies that will be picked up by the Commission, by Member States, by the Council, and by broader society to ensure that we advance equality, not only in society, but particularly in this context, in the area of healthcare. Thank you very much.
MEP Helena, thank you so much for your openness. You have opened the door for us, and thank you very much that we could host with your support this event. So many colleagues are here, so many really tough women are here, really competent and skilled women, and advocacy organizations, institutions. Thank you so much to all of you. Thank you also to my colleagues from the Institute who worked very hard for this, developing this strategy and so on. Just one sentence by the end. Healthy, empowered women are essential to healthy, resilient and sustainable Europe. And we have here feel a lot of energy. We have so many power. Don't lose it. Please go on doing, and it is now really time to go on, and coordinated action is really needed and wished. Thank you so much to be here and to support us.